Good morning. This is Dr. Rajesh Mehra from Chantilly Family Practice in Chantilly, Virginia, bringing you some health tips in this episode, Worlds of Medicine. We have been doing a series on habits. We've been doing a series on alcohol, smoking, sleeping, and going along with the sleeping theme, we want to talk about something called sleep apnea. What is sleep apnea? Sleep apnea is when you think you're sleeping soundly, but you're not getting enough oxygen to your brain because due to some anatomical situation in your throat, your tongue covers your breathing pipe, and even though you're sleeping, you're not really resting well, and the next day you may be tired. One of the frequent symptoms of sleep apnea means basically your brain, your body stops to breathe for a few seconds, is snoring. The reason you snore, and we all think sometimes we do, is because the tongue covers the breathing pipe and it makes a loud noise. Now, not everybody that snores has sleep apnea, but it is 80% or more common for people that are snoring may have sleep apnea. So how do you diagnose sleep apnea? Well, to diagnose sleep apnea, you have to first see your primary care doctor, who will then refer you to a sleep lab, which is basically an office, a doctor's office type thing, but where you sleep all night. And while you're sleeping, your blood pressure, your breathing, your oxygen level is being studied closely for at least 8 to 10 hours, and then a diagnosis can be made whether you do or you do not have sleep apnea. This is very important to diagnose because if you do have sleep apnea, this leads to having high blood pressure, this leads to depression. Of course, it leads to being fatigued all day. So the sooner you treat sleep apnea, the better. More important, the sooner you get it diagnosed, it would be very important to see if you do or you do not have sleep apnea. Nowadays, the technology has advanced, so the diagnosis has become very easy. So sleep well, be careful, and see your doctor if you have any symptoms.